Hello, everybody. I'm Dr. Matteo Forlini from Italy. I'm a vitreoretinal consultant in Ravenna and in San Marino State Hospital. So I present my talk about how to manage traumatic cataract and iris laceration. So the first question is it possible to correct this problem simultaneously? And second question is, how much iris tissue do I have? If the iris tissue is still enough to create an pupilloplasty, of course, you have to choose for the iridoplasty techniques like Sipser sliding knot technique or McCannell iridoplasty technique or iris cerclage technique. In this way, you can save the iris and you can use the iris tissue in that eye. On the other hand, if you have a total aniridia or subtotal aniridia, you don't have enough tissue to create a new pupil. So you have to choose for the artificial iris prosthesis. What to do if you have the iris tissue and you want to create a new pupil? Of course, first maneuver is to correct the cataract. So usually you have to perform a normal phaco. You have to pay attention to the zonula. You know that with traumatic cataract, often you can find zonulodialysis or zonular weakness. So you can use, if you need, you can use capsular tension ring or Sionni or HACMED capsular segment. You have a lot of devices helping to stabilize the zonula. Then you will perform your phaco. You have to pay attention to the bag, of course, and the best, of course, is to implant the IOL in the bag if you can. Or if the bag is very damaged, you will use the IOL implantation in the sulcus. Or if you don't have a good bag, or maybe it's too much damaged, you can choose for a secondary IOL implantation, like iris claw or a scleral fixation. After that, you have to focus on the iris. So the first thing to remember is to massage and unroll the iris tissue from the angle. With bimanual maneuvers, you will use a forceps and a spatula, and you have to gently massage the iris tissue from the periphery to the center. In this way, you can obtain much more iris tissue than you think. After that, also because you have to test the elasticity of the iris tissue. If you have a good iris tissue and elastic iris tissue, you can proceed with the suture and with the pupilloplasty techniques. So these are the main points of my talk. And following these tips and tricks, usually you can have a good result managing post-traumatic cataract and iris lacerations. Thank you very much.